Let's get started. Thank you everyone for coming to today's Climate Ready Healthcare Building Resilience with Collaborative Toolkits webinar. My name is Michaela White, and I'm a sustainability analyst at UCSF Health, and I'll be moderating today. Across California and the United States, vulnerable populations are facing devastating consequences of the climate crisis. As a healthcare system, the University of California Health System is dedicated to ensuring equitable care by addressing the impacts of climate change. Given healthcare is one of the most energy and resource-intensive sectors, UC Health is leading a system-wide equity-centered initiative to reduce its contributions to climate change and to assess its operational impacts on vulnerable populations in the communities it serves. The Transforming UC Health Systems to Reduce the Impact on Climate Vulnerable Populations project was established in 2022 with a 2-year timeframe. There are 3 objectives of this grant project. The first is to reduce greenhouse gas emissions by transitioning to a portable system for nitrous oxide. The second is to create dynamic sustainability reporting for UC Health. And the third is to develop health system resilience plans and best practice toolkits. Today's webinar is intended to cover the third objective of the grant project, developing climate resilience toolkits. So, acknowledging that UC Health is underprepared for climate disaster events and the corresponding impacts, each UC Health Center created a climate resilience toolkit with input from stakeholders and subject matter experts, designed to provide proactive and effective adaptation measures to address the intensifying climate change hazards across the state. These toolkits will better prepare UC Health to face impacts from climate disaster events by reducing risk exposures and vulnerabilities and increasing equitable operational resilience. The results of these toolkits can be used to assist other health systems in their efforts to incorporate resilience into operational plans to prepare for the short and long-term health needs associated with adverse climate events. They are intended to be shared across the UC Health System and beyond during organized climate community outreach events, which is the goal of today's webinar. The toolkits are currently being published and will be shared once available. During this webinar, we'll hear from each UC Health Center about their climate resilience work and the toolkits they are developing. Up first is UC Davis Health.
Hi, everyone. Can you see my screen?
Yes.
Great. Welcome, everyone. Thanks so much for attending this webinar. My name is David Barnes, and I am going to introduce the most of the members of our team that were involved in the development of our climate resiliency toolkit. And I'm just going to go in order on the screen here. Christina Baer, who is also on the screen, is our Director of Sustainability at UC Davis Health. I'm David Barnes. I'm an emergency physician and Director of ED Sustainability at UC Davis. Helene Margolis is a professor of medicine and bioethics in the Department of Internal Medicine. Katrin Tyler, I'm sorry, I skipped over. Reshmi Prasad was our sustainability fellow last year. Worked closely with Christina and very helpful on this project. And Katrin Tyler, an emergency medicine colleague of mine who is a professor of emergency medicine as well as vice chair for geriatric emergency medicine and wellness in our department. So we'll be talking about our implementation and rollout of the UC Davis Climate Resiliency Toolkit. And we started with identifying the framework, how we wanted to approach our toolkit. We started with the climate hazard model. We borrowed from the International Energy Agency to really help frame what the problem is that we're facing. That model triangulates hazard, which is the potential occurrence of a climate or weather-related event, vulnerability, which is the propensity or probability to be adversely affected, and then the exposure, which is the assets, services, resources, including human beings, lives, or infrastructure that could be adversely affected. And the options for different types of climate hazards is extensive, anywhere from temperature extremes to abnormal storm intensity, fire, flooding, drought, air quality, zoonoses, all things that we're facing now and potentially increased vulnerability in the future. We were aided by, sorry, we were aided by the UC Davis Health Office of Emergency Management, which provided a climate hazard vulnerability assessment in 2022-2023, which identified wildfire air quality probably on the heels of the Camp Fire just north of Sacramento, but some other wildfire air quality issues across the state. They identified that as the most pressing climate hazard, followed very closely by temperature extremes, either severe cold or severe heat. And then they also forecasted those out into 2050 and 2080. And temperature extreme really resonated with us as something that we experience very regularly here in the Valley, in Sacramento in particular. I'll turn it over to Helene.
Yes. Hi there. Having lived through the 2006 California heat wave, both working at the California Department of Public Health as well as UC Davis, what came out of that was that we were not prepared in any way for a massive event, even though in 2003, Europe had experienced a summertime heat wave that took about a 70,000 mortality toll across Europe. So in 2006, we had a 2-week event that affected the entire state. What this slide highlights is that for the estimated, across the state, there were estimated 660 excess deaths. Colleagues and I did a deep dive into 140, coroner's reports. And of those, these data reflect 126 of the classic heat stroke cases. Most of them were older adults above 65. And this highlighted the intrinsic risk factors among this population. So you had cardiovascular, psychiatric, which overlapped with alcohol and drug abuse, misuse. Pulmonary was relatively low. And when we looked at the other critical factor, which is exposure and air conditioning, while the data was not great, because again, these are coroner's reports, what was highlighted is 13% of these cases. Again, these are older adults living alone at home for the most part, but with many with contacts. 13% had functional air conditioners that were not on. Next slide, please. So in follow-up to the mortality data, we did a study of the emergency department visits and hospitalizations for heat-related illness and heat stroke, and that's inclusive. And the highlights on this slide, well, first of all, what you see of those different colors, those are different regions approximating climate regions in the state. And amazingly, the highest rate of emergency department visits for heat-related illness was in the Bay Area. And there's the key point there is that the actual temperature rarely exceeded 90 degrees. So that is message number one. You do not need 110 degrees to succumb to heat illness. Message two is that there's spatial variation. Next slide, please. So this, you do not need to read this table. The highlights here, what we did here, these were rate ratios looking at the 17 days of heat wave days compared to 17 not heat wave days, same summer. These are state administrative data for emergency department hospitalizations. Two key messages here. When you look at the ED visits, they were highest again in the Bay Area. If you look at the more extreme requiring hospitalizations, the highest rate was in the Central Valley, where we also saw the highest rates of mortality, indicating more severe outcomes related to highest temperatures, which were in that 110 range day and night. The other key message here is that above 65-year-old in the age group, they had double the rate in both emergency department visits and hospitalizations compared to any other age group. Which means that they are, in fact, our target population for risk reduction, both because of the number of cases and the likelihood that they're going to be more severe cases. Thank you.
So, one of the things that we faced was that even though, much of this clinical advice is widely known, there's still this discrepancy between older adults recognizing that they are at risk. And certainly in my own family and probably in many others, there is some sort of terminal stubbornness on behalf of some of the older generation. And additionally, we know that some people who blame some of the limitations directly on aging are less likely to make appropriate changes that may in fact be life-saving in some issues. Next slide, please. So we sort of were focusing specifically on extreme heat as it applied to the older population. And we wanted to produce a toolkit that was, both focused and also accessible in all of the senses, that it would be easy to read using appropriate language, that it would be accurate, and also that would be actionable.
So we'll briefly describe our methodology. We have multiple experts assembled here in our work group, including backgrounds in clinical medicine. And Katrin and I routinely see heat-related illness in the emergency department in our roles as emergency physicians. Background in basic sciences, policy, and public health with Dr. Margolis, and then background in sustainability design with Christina and Rashmi. We performed a literature search. We had multiple interdiscussions from August through December 2024. And really, with the background that Helene and Katrin have just covered, narrowed our focus to heat and extreme heat in a population aged over 65 years. Our deliverable, our goal was to design a patient-facing, patient-centered two-page handout that could be printable or available in PDF format and shareable across a number of different platforms, electronic, printed, handouts, etc. And our framework, which we really refined over those multiple interdiscussions, focused on awareness of the problem, preventing the problem, recognizing the onset of heat illness, responding to it, and then rescuing once it's in full swing. So in the next two slides, you'll actually see the deliverable that we created. This is page 1 of that handout that we titled Extreme Heat and Preparedness Toolkit. Again, I want to emphasize that the point that Helene made, this does not, the illness that these vulnerable patients face does not have to be what we consider extreme heat. It can be modest heat elevation in the right circumstances, in the right patient, and as we saw in that 2006 heat wave. So you'll see here that we laid out that framework in a visually appealing format from awareness, prevention, recognition, response, and rescue with colors that sort of flowed in severity. And each step is provided or provides the reader with helpful evidence-based tips about how they can execute each of those steps.
So I think we're out of time, but the second page sort of followed on with some really practical tips about what the local resources might be and specific heat-related symptoms that people might be able to recognize in themselves or in people that they're caring for, and that we had specific instructions about what to do when things were getting really tough and people were getting severe symptoms, so that hopefully people would get medical help ahead of that time. And I know we're out of time, so we'll go just quickly to the last slide. And, the goal is that we disseminate this, fairly widely across multiple groups, and particularly to more vulnerable patient populations. So thank you so much for your attention, and we'd be happy. Well, actually, I don't think we have any time for the questions, but if you put questions in the chat, we'd be happy to answer them.
Thank you. Next up is UC Irvine Health.
Great, thanks, Michaela. Let me go ahead and share my screen. Can everybody see that okay?
Yes, looks good.
Okay, perfect. So good afternoon, everyone. Thank you for joining us today. My name is Courtney Lusk, and I'm the Sustainability Program Manager at UCI Health. And I will be kicking us off, and then I will hand it over to my colleagues, Rosie and Carlo, to introduce themselves as we go along. But today we're talking about our toolkit that was focused on community engagement strategies for building equitable climate resilience. As anchor institutions or large organizations that are rooted in place, hospitals have a real responsibility to ensure that their communities are healthy, safe, and resilient. And that really extends beyond just the internal stakeholders, so your patients, staff, and visitors, to also include folks outside the hospital walls and the broader communities that we serve. So because climate change disproportionately impacts the health of vulnerable communities, it's essential to include these communities in climate resilience planning. So in creating this toolkit, our purpose at UCI Health was to create a resource for healthcare facilities that would be focused on external engagement in the context of climate resilience. So our hope in putting this out into the world and really talking about our work today is that the tactics and the resources that we share can act as examples for how to engage with community members to co-design innovative and effective climate resilient solutions. And for the interest of time today, we'll just touch on some of those key engagement strategies. So I'm not going to go over all of the bullets on this slide, but I think it's important to ground us in the impacts of a changing climate and how it has affected and continues to affect the communities that UCI Health serves across Orange County. The one thing I want to point out here is that we experience in our region, as do many other UC service communities across California, the heat island effect. And so this occurs in urban areas where heat is trapped within the city, caused by uneven, inequitable spread of land covers in the urban landscape. And then what happens is that this then leads to heat absorbing buildings and pavements and fewer cool spaces that are generated by trees and greenery where people can go to escape the heat. And so for the focus of our toolkit, we narrowed in on the city of Santa Ana for the various reasons you see on this slide. Santa Ana is the third most populous city in Orange County and the 14th most populous city in California. The demographic data shows that there are also many vulnerable populations living in the city of Santa Ana. As seen in the first bullet, the city also experiences the heat island effect that I just described. And so our team really narrowed in on the climate impacts of extreme heat in particular. One benefit we saw to focusing on Santa Ana was that our FQHC, or Federally Qualified Health Center, is located there. And so the clinic has established connections to residents and community-based organizations that our team felt would make it easier to engage with folks in the community and to learn more about existing climate resilience planning. As our team embarked on community climate resilience planning, we knew that relationship building was key to our process. So we set an objective to establish community partnerships and to ensure that community voices are represented throughout our process. You could see here some of the approaches we took, beginning with establishing an outreach team, conducting stakeholder mapping, developing an engagement plan. We also documented our engagement, and then finally took our learnings to then develop educational materials that could be used as tools to really deepen our connections with community and increase their adaptive capacity. So how did we engage the community? We used several different methods of engagement as shown here, but for the interest of time, we'll only touch on those that are bolded. So our community workshops, tabling events, and then we'll talk a little bit about how we used asset maps to generate and share data with community members. And so with that, I'll hand it over to Rosie.
Hi, everyone. Good morning. My name is Rosie, and I'm a PhD student in the anthropology department at UC Irvine. And as Courtney mentioned, I'll be taking on the next few slides. So we hosted workshops that served as an opportunity to introduce ourselves to community organizations that are well established in the local cities and neighborhoods around UCI health clinics and hospitals. One of our workshops was actually at the Santa Ana Family Clinic that Courtney mentioned earlier on. Through these workshops, we had deep conversations about climate resilience and learned about the ways people in Orange County are adapting to a climate change environment on an individual and collective level among the community. Not only did we establish new relationships and strengthen existing ones, but the workshop also provided us with much reflection on how we can move forward with our methods of engagement. So this led to our tabling and mobile outreach events. Courtney, if you can go to the next slide, please.
Yeah.
So we kind of decided to do tabling and mobile outreach events at bus stops and in front of the Family Health Clinic in Santa Ana. In the photo below, that's me, and you can see the bus stop there. So we engaged in these practices during hot and rainy weather, which was really interesting. It taught us a lot through conversations and just, observations that Carlo and I were making. During warmer days, we did hand out water, fruit, and resources about heat-related illnesses in both English and Spanish. These experiences granted us the opportunity to learn and document how community members are responding to climate events like extreme heat. It was also a time for them to ask questions about heat illness. We used tools such as interactive maps and surveys, and really just focused on everyday type of conversations with those stopping by our table, especially those who were waiting for the bus. Our biggest takeaway from these moments really was learning about community members who may not necessarily be involved with our community partners, but very much impacted by climate change on a daily basis. And I'll hand it over to Carlo.
Hi, everybody. I'm Carlo Chunga Pizarro, a PhD candidate in the urban planning department. And I'll be talking a little bit about what we did in terms of asset mapping. So asset mapping is basically a method for community and capacity building. It allows for communities to identify existing resources. It has been used majorly to investigate social issues, community development, to explore, describe, and develop solutions to community through spatial analysis. And so for our context, we wanted to practice using asset mapping as a potential to balance risk and focusing on the expansion, strengthening community resources for local organizations. So using the UCI JEDI resilience planning framework, we gather data on physical assets, natural assets, cultural assets. That includes things like landmarks, green spaces, energy infrastructure, and we just created a huge database in order to, whenever we went to community space, we would quickly create maps like the next one that we're about to show in the next slide. So maps like this using ArcGIS software We would show to different community organizations and workshops and even tabling outside to show them, for example, these specific areas of the city is harder than others, and it says how many bus stops are along this route. And so using these maps, people will reflect and talk about their experiences in different parts of the city of Santa Ana. And I'll hand it over back to Courtney.
Oh, you're muted, Courtney.
Thank you. Thanks, Carla. Thanks, Rosie. So in conclusion, these are some of the key takeaways that we wanted to share today. Through this process, we engaged 20 community-based organizations and over 100 external stakeholders to date. We've also expanded the strategies discussed today to also engage at-risk populations in other local communities that we serve, designated cooling centers, and then we've also begun working with some community and senior centers to provide educational presentations on climate resilience. We continue to ask what our role is as healthcare providers in mitigating the community vulnerabilities that we've identified. One area we know we can offer support is through education, and so we continue to find opportunities where we can share information and resources with communities. And then finally, we recognize that community climate resilience planning is a work in progress. Our goal is to ensure that all community members have a voice and an opportunity to participate in the resilience planning process, and we're continuously learning ways to improve our engagement strategy and to forge meaningful partnerships. And so just to close us out here, I wanted to end with some of the lessons we've learned along the way. Starting with relationship building takes time. So one suggestion that our team has is to work with accessible partners to get your foot in the door. Engagement comes in many forms. We all know that communities are incredibly diverse. This means engagement methods also need to be diverse. So whether it's through communication, participation, or education, what links all the various engagement activities is intentional interactions with stakeholders that meet them where they're at. Each organization plays a unique role in co-creating community climate resilience solutions. Also, don't assume you know what the community needs. Take a step back and let the community lead when it comes to building solutions that are right for them. Consider accessibility when planning an event and be prepared to provide appropriate accommodation. So this could mean holding events at various locations and times, or offering stipends, childcare, and interpretation services, for example. And then finally, be flexible because things don't always turn out as planned. And then I'll end on this last slide. I wanted to recognize all of the organizations that participated in the community-based resilience outreach and planning efforts. And we do look forward to continued partnership and continuing the work of building a more climate resilient future. Thank you.
Thank you. Up next is UCLA Health.
Hi, good afternoon, everyone. We'll just pull up our slides now. And I'll give a quick introduction. I'm Dr. Rosemarie Falieres. I'm a family medicine and lifestyle and integrative medicine provider here at UCLA. I also was a UC climate ambassador last year, helping develop statewide climate change curriculum for different health professionals. And I will let Annie introduce herself.
Hi, everyone. My name is Annie Huang. I'm a third-year emergency medicine resident physician here at UCLA. And I'll give it to Rosemarie.
All right, and I did want to just mention Sarah, who is on this call as well. She is the Sustainability Programs Manager, and I'm working closely with her on a new UCLA Climate Resiliency Task Force, which she is heading. So I'm very happy to be working with her on that as well. So I will be presenting our work on developing a toolkit for workforce preparedness in the event of 3 specific climate events that California residents can be exposed to. We realized that we wanted to focus our efforts on gaps that we could fill, which were really exposed after the recent LA wildfires as well. And this is not a detailed emergency response plan. This focuses on short-term responses and long-term resiliency for the workforce. So that includes medical assistants, nurses, front desk staff, physicians, residents, transportation staff. So anyone who is employed by UCLA. And this first slide looks at the first focus. So we're going to be preparing the workforce and providing a toolkit for training and protocols. So in the event of extreme heat, we're going to make sure that the workforce can recognize heat illness and have training in rapid response to that. Also, we're going to provide guidelines on hydration, cooling measures, and then also education for vulnerable populations. So if there's an elderly person who works at UCLA, how can they better prepare themselves? Someone who's pregnant. And then for the wildfires, which is a little similar to the poor air quality measures, but we want to make sure that there's emergency evacuation procedures and route planning outlined for the workforce. Also training and burn and smoke inhalation, what to do then. And then also if they need to coordinate with local fire departments and emergency services, how to follow a protocol that outlines that relationship. Annie was working at the All of You UCLA hospital during the fires. And if you want to share your experience about how the wildfire was very close and affected you all, and how there was chaos, right? There's no outline. Sure that the UCLA emergency response team had a protocol and they were following it, but all the workforce were kind of in the dark. If you wanted to share that, Annie.
Yeah, I can briefly share. Working at All of You, I was in the emergency department when the Hearst fire came out, and it was extremely very close. So you could see it kind of from the parking lot. And I think at that time, everyone had a sense of, obviously, of inner panic and trying to figure out what to do. And eventually communication was given to us about next steps. But I think during that time where there was a bit more basically not having the information right then and there and knowing what to do, that sense of uncertainty was very, very present. And I think that is something we're hoping to kind of fill the gaps on.
Right. And then Annie also mentioned that the power went out, and this is before they received communication. So really they were left in the dark on what to do. And even they were doing protocol or procedures in the dark without electricity, or well, they had a backup generator, but it was scary for the patients and their workforce there as well. And then the wildfires caused poor air quality. And there was a lot of confusion about the AQI. There were internal messages going around, emails about patients and healthcare workers and just the workforce asking, can we trust the AQI? There was no formal information given to the workforce. So we created this toolkit to make sure that the that air quality index would be outlined in this toolkit and explained to the workforce as well. And then also, if a workforce has a pre-existing condition like asthma, how to identify if they're having exacerbation, if they're going to have a potential COPD flare-up as well. And then possible triage protocols for those with respiratory conditions during days that have high AQI. All right, so we can go to the next slide. So this is going to be the next topic in this toolkit. So PPE and supplies. So during extreme heat events, we want to make sure that the workforce is aware of wearing cooling vests, lightwear, moisture wicking uniforms. Maybe UCLA can even offer this in their bookstore. And then also making sure that offices have hydration stations as well. And that staff are offered portable fans, misting devices, their cooling towels. I even know in my own work, in my own clinic, it gets very, very hot. We're right behind a window. We just recently had to request portable fans. So if the system can already offer that to patients to prevent conditions related to extreme heat. And then during wildfire events, making sure that workforce have appropriate masks and eye protection as well. And then potentially burn care supplies as well. And then during the event of poor air quality, making sure that the workforce has access to N95s that are properly fitted, and that clinics or offices also have these HEPA air purifiers in the office, in addition to regular indoor air quality monitoring in their offices as well. All right, to make note to the next slide, perfect. And then lastly, we want to make sure that the workforce feels supported. By interviewing a lot of employees during the LA wildfires, we were able to understand that many staff members do not feel supported, and that's from residents to transportation workers to physicians. It depended on how communicative the manager was, the overseeing manager was. And a lot of times a communication was not provided to the workforce. So making sure that during events of extreme heat, the workforce do get mental health resources, potential transportation as well, if they are taking the bus or they have to walk a few miles, making sure that potentially they can use the UCLA bus or something like that to help, and then potentially adjusting shift times as well, shift schedules. And for wildfires, making sure that, again, mental health support is provided, which was provided eventually. It took about a month to kind of scramble and give that support to at least physicians and residents at UCLA, and then potentially offer the remote work options as well. Discuss transportation support and offer family care assistance, which UCLA went above and beyond. They provided lodging as well, or they gave discounts for lodging, talked about resources for family care assistance, but none of this was formalized, right? This was just all on the spot, and it really depended on which department you were in. So we want to be able to expand this toolkit to really every department at UCLA. And then in the event of poor air quality, making sure that remote work is also offered, and then also having someone check in on the staff who have and designated that they have high-risk conditions as well, and then possibly give some discounts as well, partner up with different companies for air quality devices. So really, we're trying to fill this gap for workforce preparedness as well. And then based on the other resources provided by you all, we would like to develop potentially physician-facing or patient-facing resources. Since UC Davis did the patient-facing for extreme heat, maybe we're going to be able to do for wildfires and air quality, just a one page that we can upload into our EMR. We've already touched base with the team with patient education, and we have a process for uploading the PDF and being able to attach it to diagnoses, and then able to search it within the EMR, so you can automatically send it to patients via my chart message, or just attach it to a diagnosis and print them out in the after visit summary. Yeah, so that is our work thus far. If you have any questions, feel free to ask.
Great, thank you, UCLA Health. Up next is UC San Diego Health.
Thanks, Michaela. Okay. Hi, everyone. My name is Nicole Paletto. I'm a sustainability analyst at UC San Diego Health, and I am joined by Zach Taman. He was our clinical sustainability fellow in the previous year. He's now a fourth-year medical student at UCSD, and he created these amazing toolkits that I'm going to share with you, supported by Dr. Shira Abelis, who is our medical director of sustainability and an infectious diseases doctor here at UC San Diego Health. There we go. So we've been on our climate resilience journey alongside our other UC Health locations for about 2 years now. We've focused first in partnering with our emergency management department in terms of planning for risks, thinking about how we can ensure that we are protecting our people, our services, and our assets so that we can continue to provide services during climate events. And so we created a climate resilience hazard vulnerability assessment, which is a tool that emergency managers are already using, but essentially incorporated climate resilience into that tool. So rather than looking at the probability of climate events happening by looking back to see what has happened in the past, it now takes into account a future forecast of climate risk. We also worked alongside our campus and drafted a UCSD Climate Action Resilience Plan, which will be released next month. And through that effort, we identified some top climate hazards for UC San Diego in particular. And those were extreme heat and humidity, precipitation and wind, which leads to flooding, wildfire, and drought. And we thought about these climate hazards in the context of how will they affect our people, our services, and our assets again. And people includes not only our patients, but also our staff. And so we wanted to make sure that our clinicians were prepared in the event of any climate hazards. And thinking back, last year in January of 2024, San Diego had a 1,000-year storm. Our buildings experienced numerous leaks. We had partial day clinic closures, storm drain backups, and some flooding outside of our East Campus hospital. And so the purpose of our clinician information sheets are essentially to prepare our providers in what to do in the events of these extreme weather disasters. And for the case of flooding, thinking about especially infectious diseases that might be popping up in the following month or two following an event. And with that, I will pass it off to Zach, who will talk a little bit more about why the toolkits are important.
Thanks, Nicole. So yeah, the question of why are the clinician toolkits for climate change important? We brainstormed this idea regarding a toolkit as we quickly recognized that there are quite a bit of resources present at the local, state, and federal level. But also there is a challenge sometimes in finding these resources. And then clinicians, first responders with time constraints usually can't really afford to hunt down these resources and also peruse through them to see which is fitting or best used for their scenario. We also recognize that there have been system-wide practices to increase climate resilience, but we also found that these are not easily incorporated into the clinical practice and setting as well. So we first started by looking into the most common or problematic adverse events in our San Diego region, as Nicole has stated, and then what resources were available to combat and mitigate them. And then we tried to create one toolkit per each or per climate adverse event, and then include all the resources in them as well. Next slide, please. So the goal was to create a toolkit in a digestible format for clinicians, knowing that our clinician folks love something that's very easily applicable and useful. So we really try to prioritize tables, images, and also with the goal of connecting people with these resources as well. We included location details of these resources and what they best suit, whether they are best suited for first responders or those affected or patients as well. We also included practical guidelines for the acute challenges relating to climate change, and also the information, the resources, and the guidelines were all collected under literature review, as well as making calls and emails directly to the identified resource centers as well that we came across. And some of this was also gathered through networking as well with our own clinician sustainability work group as well. And these included subject area experts that helped inform these toolkits as well. These are folks from different departments under UC San Diego Health that included ophtho, nursing department, medicine, and even anesthesia as well, to name a few. Next slide, please. So for each toolkit, we started off with a table of contents, prioritizing first the clinical information in the first 3 or 4 pages, followed by general information relating to public health, latest research findings, and also a case study where relevant. Resources for patients were also linked on the front page for easy access as links, or as easy access to links for these existing resources as well. Aside from the clinical guidelines, roughly half of the content focuses on vulnerable populations, such as pregnant individuals, lung health patients, those with asthma or COPD, cardiovascular patients as well. And under each subcategory of affected vulnerable populations are resources specific to that population that may be helpful. The last section is reserved for a listing of available resources for physicians or clinicians in general as well. We also included a small section to highlight continuing medical education courses, usually worth 1 credit, each for an interested physician or clinician. These courses are, of course, related either to the draft's topic or the climate change being addressed in that toolkit specifically. So for example, the Wildfire Smoke Toolkit, we have a table of contents and we highlighted health impacts of wildfire smoke and common risk factors contributing to increased morbidity and mortality. These include, of course, pre-existing respiratory illnesses, cardiovascular diseases, among others. And because smoke exposure inevitably leads to smoke inhalation injuries, we also included management guidelines for smoke inhalation that was adapted from the American Burn Association with a direct link to their clinical guidelines as well. And the target audience for this toolkit are clinicians, but we also wanted to form it in a way that even it helps bystanders or even patients as well. Next slide, please. So for a deeper dive into the toolkit, we recognize that there is importance in framing the issue, but we also were mindful that clinicians sometimes want less reading material and just to be given the most high yield, impactful information directly. So we tried to create a balance out of this by providing the high yield facts we've come across in our literature review, but also directly linking to these resources, the guidelines, wherever applicable. Next slide, please. Some toolkits will also have sections that address a unique issue for the climate health adverse event being taken into account. For example, strategies for reducing smoke exposure under wildfire smoke conditions, whether it be indoor or outdoor, as you can see here, and also even highlights for other things like medications and their altered metabolism and chemistry under extreme heat conditions as well. Just things to keep in mind and to act upon where appropriate. Next slide, please. And this is to show you some of the vulnerable populations we have addressed, pregnant patients and lung health patients. Under each are relevant information for resources, infographics, or other guidelines that may be helpful. We also provided and highlighted the Center for Climate Health and Equity and the infographics that they have provided as well. And as previously mentioned, we also included a list of targeted resources for physicians and the courses for continuing medical education credit. Next slide, please. So for our next steps, in the event of climate adverse events, these resources will be distributed. There are links to emergency medicine, all staff emails that circulate through our tiered management system as well. There's also passive education posted to the UC San Diego Health internal Pulse website. And we have also brought it up in management meetings as well and distributed it during events. We also have other toolkits in the works targeting specific scenarios that we've seen that affect our region as well, but not entirely unique to us. And these include algal blooms, molds after floods, and even vector-borne diseases as well. Next slide, please. So to wrap up, we just want to finish on a note that these are UC San Diego's health climate efforts and also the clinician toolkits that have been kind of put together to address not only the things that are unique to our region, but we also come to understand that, we have shared this struggle throughout the entirety of the state as well. Thank you.
Great. Thank you, UC San Diego Health. So up next is UC San Francisco Health, and I will be presenting. Again, my name is Michaela White, and I'm a sustainability waste analyst here. So when looking at toolkit topics, we started to see an overlap between climate resilience planning that was going on and our emergency management department. So we decided to make our toolkit on climate resilience and emergency management integration, with the goal of helping to formalize the climate resilience planning process. So here's a little background about the climate resilience planning happening at UCSF Health. There are two main groups that have been doing climate resilience planning. There's the UCSF Climate Resilience Core Team. The core team is made up of 10 different departments across UCSF Health and UCSF campus, and they meet monthly to do climate resilience planning. And then next is the UCSF Health Sustainability Department, which I am a part of. Within our department, we are working on two main projects relating to climate resilience. There is the White House Health Sector Climate Pledge, which has a deliverable to create a climate resilience plan, and then also this grant project. So when looking at climate risks, we worked with an external consultant to project what would be most relevant to the San Francisco region. And those were extreme heat, wildfire and wildfire smoke, drought, and flooding. Then when identifying vulnerabilities, those were classified into assets, populations, and services. And there were a few different identification strategies that were used. First, our consultant provided us with a climate change hazard overview, which is a brief summary of the types of vulnerabilities to be expected. Next, we brought these vulnerabilities to a bunch of different stakeholder workshops where we got some firsthand experiences from stakeholders on these types of vulnerabilities. And then next, we have been working on the climate impact assessment, which has been formalizing these vulnerabilities and giving them a numerical ranking based on experiences from subject matter experts. And then looking at emergency management at UCSF Health, the Emergency Management Department is responsible for managing emergency preparedness, mitigation, response, recovery, and business continuity. So when looking into the Emergency Management Department, there is a lot of overlap with emergency management and climate resilience. Two key points I want to highlight today are the disaster plans and the hazard vulnerability analysis. So disaster plans are procedures for emergencies, and there's a few different ones that overlap with climate, for example, flood, severe weather, and excessive heat. And then when looking at the hazard vulnerability analysis, here is a sample, similar to how UC San Diego mentioned. But this shows risks on a 1-year time frame and helps rank them to identify top priorities. So the HVA works by comparing the probability that the event will happen to the severity of it. And the severity is made up by the impact to the business, property, and humans compared to the preparedness and responses. So when looking at climate resilience and emergency management, though there are a lot of overlaps, there are some gaps. So one of the gaps would be a limited time frame for the HVAs. Since they're only completed on a 1-year basis, it prevents long-term climate effects from being prioritized. We also noticed that there is a lack of established procedures for climate resilience preparation and mitigation. So to solve these gaps, we came up with the Climate Resilience Emergency Management Integration tools. The first tool I'm going to be talking about is the Climate Resilience Organization Chart, which outlines who's responsible for managing climate resilience efforts and also identifies different departments and subject matter experts to gain support and input from. So at UCSF Health, the climate resilience leads would be the climate resilience core team, sustainability, and emergency management. And then the collaboration would be various departments at UCSF Health and UCSF campus. The next tool is a climate HVA. So this is very similar to what UC San Diego has been working on, where it's the hazard vulnerability analysis, but it includes the timeframes that the climate impact assessments look at, which includes the 2050s and the 2080s. So this will help risks that are happening further down the line be prioritized. And then finally, this is our third tool from the toolkit. It is the largest one. It is the Climate Resilience Planning Checklist, which establishes procedures for before, during, and after climate hazard events. So before events, these are the planning steps. So this is the largest bulk of the planning checklist. I'm not going to call out every single one of these, but I'll highlight a few really important ones. One of those being the accountability matrix. So this would assign responsibilities to those members of the climate the climate team. And then based on those, we would create an impact effort analysis timeline. This is very similar to a cost analysis timeline, which identifies priorities and some big ticket items to create some low-hanging fruit objectives to solve those climate planning issues. Based on that, we would want to establish target goals and establish funding to achieve those goals. And then we also would want to start developing procedures for climate emergency events if they don't already exist within those disaster plans. We also would want to align our response protocols with external stakeholder groups, such as the city, other health centers, and community groups. And in doing so, we would want to create a knowledge campaign along with emergency notifications so that everyone at UCSF Health knows of the climate resilience work being completed, and then can help create those notifications to be sent out before and during emergency events. And then finally, we want to integrate the climate resilience work happening with other health system policies and plans, such as the long-range development plan. During disruptions, we would want to deploy those emergency procedures and send out the emergency notifications. And then during recovery, we would want to host a debrief with the climate resilience management team, create an after action report, and then based on that, we would want to update the before disruption materials as appropriate. So when looking at next steps, we would want to implement these tools. We haven't completed everything on that checklist, so starting to work towards that checklist would be a great next step. We also would want to expand the location scope of this project. So when we projected climate risks with our consultant, it was only for the San Francisco region. However, UCSF Health has many clinics in the Bay Area and across California. And even the UC Data Center located in Washington would be a good place to do these climate impact assessments to figure out what the climate risks are for those locations. Now, another next step, which was brought up by our emergency manager, is to revise the HVA framework to include the long time frame. So the HVAs currently are required by healthcare accrediting bodies, such as the Joint Commissions. So creating the HVA to have a longer time frame wouldn't be accepted by them since we have to use the HVA format. So to include the long-term look at the 2050s and the 2080s, it would have to be a discussion with health centers across the nation and with those accrediting bodies to see if that is something that can be changed in the future. The reason this was brought up is because the long-term outlook is helpful for climate risks, but it also would be helpful for all different types of risks. So that is something that our emergency manager was very passionate about. And I would like to do some acknowledgements. I know we're short on time, so I won't read all of these, but I just want to quickly shout out the Sustainability Department, the Climate Resilience Core Team, and the Emergency Management Department. And with that, I'll do some closing remarks. Thank you all for sharing your climate resilience toolkits. We also want to thank the UC Health Office of the President for making this grant opportunity possible. While UC Health is making significant progress towards addressing key vulnerabilities and risks and establishing resilience, it recognizes that resilience planning is an ongoing effort. As risks, vulnerabilities, and priorities change, UC Health will continue to strengthen collaboration, engage key stakeholders, and work with external groups to further develop climate resilience strategies. These toolkits are currently being published by the UC Office of the President, and they'll be emailed to registrants along with the webinar recording once they're available. So thank you all for coming today.